Hi guys. So tonight I'm gonna do another Darlie video from the awesome Facebook page, Why Darlie Routier is Innocent, Myth versus Fact. I just want to really thank them again for allowing me to use these because, like I said, some of these are so good and it's great information for anyone who is interested in this case and wanting to learn a bit more of the facts versus the myths. Just so you have a better idea of what is actually going on here before you get started into researching and things. So that's what I'm going to do. I'm going to look through these, I'm going to share them with you, and then eventually I'm going to dig into the documents even further. So we'll start with, this is not a myth versus fact, but I've heard this a lot over the years, that Darlie's wounds to her neck were superficial. That's the term that was used, and when people who believe that she's guilty use that term, they're usually trying to imply that it wasn't serious. It wasn't a serious or life-threatening wound. But we are going to go over the actual medical definition of superficial. Here it is. Now, she was cut down to the carotid sheath, which you can see here in this picture. It's quite deep in there. So it was not a scratch on top of her skin. Definition of the medical term superficial: situated nearer the surface of the body in relation to a specific reference point. The skin is superficial to the subcutaneous fat. The subcutaneous fat is superficial to the muscles. The muscles are superficial to the bones. The term does not mean surface, as in surface scratches, nor does it mean not serious. As far as depth, it refers to depth in relation to a specific reference point. Any reference point. For instance, the heart's pericardium is superficial to the heart's endocardium lining, and yet the heart is located deep in the body. The following diagram shows the pericardium in relation to the endocardium. Note that the epicardium is inside the wall of the pericardium. That's these here. Picture of the heart. Some lay people have said that Darlie's wounds were all superficial and therefore not serious. This is simply not so. It's based on a misunderstanding of the medical terminology used, which may lead to misinterpretation of what the medical staff said at trial. This leads many healthcare professionals to wonder if the jury also consisted of non-medical people with limited medical knowledge. Did they also misunderstand the meaning of the term superficial? Recall that Dr. Santos, when asked about the depth of the neck wound, stated that doctors usually don't measure wounds because it doesn't matter the depth of the injury. What matters is in relationship to the other structures. The knife missed the carotid artery by 2 millimeters. However, if you want to describe this neck wound, Darlie came within 2 millimeters of death. That's very serious. Below are some diagrams showing the structures contained within the neck. Sorry, these aren't really big, but you can see, hopefully, this diagram is to give an idea of how deep the carotid artery is located in the neck. The carotid sheath surrounds the artery. And then here's that picture that was up at the top before. Two more views of the neck anatomy showing the carotid artery in sheath, the jugular vein, and the vagus nerve. Side view of the neck anatomy. As can be seen, there are a lot of very important structures in the neck. Yeah. So there's... yeah. Okay. Use the tool below to convert inches to millimeters. This is showing 2 millimeters. That's how close she came to being cut too deep to where she probably would have bled to death within minutes. And then there's the name of a nurse who provided this information. There is also a post from this same nurse. I don't know if I should share it because I didn't ask her permission to do so, but it is here under the information about Darlie's injuries and her hospital stay. This is something from that nurse also, and it's very good information. All right, so we'll just pop into myth number 5. The evidence was properly collected into evidence bags. If I can speak, I'm sorry. The evidence, at least some of it, was collected into Albertson's grocery store brown paper bags. The following is testimony from Officer David Mayne of the Rowlett Police Department, as cross-examined by defense attorney Richard Mosty. All right, now, you were called out there. Well, were you called out to do it? What were you called out to do initially? And I know you got sidetracked, didn't you? I was called out to help with the crime scene. Okay, and nothing more specific than that at that time? At that time, no, sir. Did you go pick up your camera? Yes, sir. And what other supplies? Paper sacks, trace evidence kit, that area. All of these Albertson sacks that we've got here? Yes, sir. They might not all be Albertsons, but they look like they're all Albertsons. You went by and picked those up? Yes, sir. And then here's some footage of Jimmy Patterson carrying an Albertsons bag at 5:45 into the video here. I don't know if I should open this, but there's some videos that you can look at if you want to come here and click these links. I'll put them in the description below so you can watch those. And then look at this. The blood smeared up past the evidence bag seal. Do you see that? It's up here where the seal is, and there's blood up in there. This just looks very sloppy. And using a grocery store paper bag, I just don't see how that could be a good idea. And there's an Albertsons bag right there. And here's another. This is an actual crime scene video. Evidence placed on the ground by the police car. Evidence bag is unsealed. And then a blanket to be DNA tested is seen here propped up against the tire and rear wheel of the police car, subjecting it to possible cross-contamination. Goodness, what a sloppy mess. And then here's Officer Mayne's testimony, which I'll link in the description as well. Okay. Myth number 6. Darlie's skin cells were found in the sock. Non-supporters have long claimed that Darlie's skin cells were found in the toe of the sock, which was found in the alley. They claim that the discovery of these skin cells explains the use of the sock in the commission of the crime. Darlie slipped the sock over her hand like a glove and then stabbed the boys. However, as the following testimony by Judith Floyd shows, the claim that Darlie's skin cells were found in the sock is unfounded. Ma'am, would you please tell us your full name? Judith Irene Floyd. Miss Floyd, how are you employed? I'm the forensic laboratory supervisor at Gene Screen in Dallas. Okay, what is Gene Screen? Gene Screen is a DNA identity testing laboratory. We do identity testing in 3 areas. One would be genetic analysis, the other would be paternity testing, and the third one would be forensic analysis. Now, you also said you testified about a faint DNA sample. What was that? From the sock? From the sock. From the testing of the toe area, there was a very faint pattern generated, which was the same as generated by Darlie Routier's blood. But that could also be the same as her skin? Correct. And that could be the same as her saliva? Correct. So if some assailant had that sock in his hand and stuffed it or tried to stuff it in her mouth, that could leave that kind of result? It is a possibility. Sorry. If an assailant had that sock in his hand and contacted her skin, it could have that kind of result? Well, I would think that would have to be pretty hard contact in order to obtain those skin cells, yes. But then you might also obtain skin cells from his hand applying the same pressure. Right, and you don't know, I guess. You don't know how long that kind of cell could be on a sock? No. And is there a way to tell that? No. No. Sorry. The above excerpt shows that it was not determined whether DNA was Darlie's skin cells or whether it came from her mouth. Miss Floyd also stated that she did not know when the DNA was deposited. She went on to say, "Would the same be true if I put this sock over my hand and wore it around all day and I am stressed? Would you expect to see my skin cells from my hand on that sock? Yes, or that is a possibility, yes." This excerpt shows that you won't necessarily lose skin cells if you were to put a sock over your hand for the whole day, let alone a few minutes. Thus, from the testimony cited above, there is no way of knowing whether the DNA in the sock came from Darlie's hand or from her mouth, and that if the DNA is indeed skin cells, there is no way of knowing when it was deposited. The tube sock was Darren's and was kept in the Routier home, so it's hardly surprising that the investigators found Darlie's DNA on it. And here's going to be a link for Judith Floyd's complete testimony, which I'll link. These are so good. Okay, here's some information about the crime scene collection, proper evidence collection. After reading the guidelines below and comparing them against the testimony regarding evidence collection, the crime scene video and crime scene photos, how many mistakes do you think the Rowlett Police Department made at the Routier home crime scene? We see 7 errors right off the bat. Hey, the following information is quoted from Best Practices for Collection, Packaging, Storing, Preservation, and Retrieval of Biological Evidence. The link to the document is provided below. Evidence collection. Biological evidence and materials should be collected in a manner that prevents contamination and degradation and ensures integrity during all phases of the investigation and litigation. To avoid contamination, sample collection tools and materials must be free from human DNA. Disposable latex examination gloves, individually wrapped swabs, or other individually wrapped items are free from human DNA by virtue of the process of manufacture. So remember those Albertsons grocery bags? I don't know how many people would have handled those without gloves, but you can probably be sure that there's some cross-contamination possibly going on there. Not all germicidal treatments destroy DNA. Alcohol and hydrogen peroxide, for instance, do not destroy DNA. The most effective way to clean collection equipment is to wipe it with a fresh 10% bleach solution of 10:1 water to bleach. Any commercially available bleach is adequate for this purpose. Clean collection practices. Here are examples of ways to prevent contamination and degradation of biological evidence. Use disposable latex or similar gloves to handle evidence rather than reusable uniform tactical gloves. Do not touch the outside of gloves to face or hands, or use personal items such as cell phones or radios, and change gloves after contact with potential biological evidence. When field testing evidence, swab the stain and test the swab rather than directly testing the stain. If the stain is small, it should be tested in a lab rather than in the field. Fingerprint powder and brushes carry biological material from one item to the next. Collect DNA samples before powdering or use single brushes and sterile powder. Clean tools between samples. For example, dip forceps in a fresh 10% bleach solution of 10:1 water to bleach and thoroughly dry prior to reuse. When it is necessary to dampen a swab to collect a dried stain, any source of water that does not contain human DNA is acceptable. Sterile water, distilled water, saline solution, and tap water meet this definition. Document which type of water is used. Dry damp items and swabs. When it is not possible to thoroughly dry the item, packaging such as paper bags will allow the drying process to continue. Wet items may be dried by hanging or by laying out on a clean surface indoors away from the scene. Package each item separately. The use of personal protective equipment, disposable clothing, gloves, masks, etc., both protects the individual from biohazard exposure and prevents transfer of the investigator's DNA to the evidence. Packaging. These are the best practices to keep in mind when packaging biological evidence at a crime scene. Package evidence and seal the container to protect it from loss, cross-transfer, contamination, and/or deleterious change. Seal the package in such a manner that opening it causes obvious damage or alteration to the container or its seal. Package evidence for safety by using boxes or breathable tubes for sharp items, marking items and informing the laboratory if a biohazard is present. Package unloaded firearms and clean unused boxes when submitting them for biological analysis. Mark the packaging and inform the laboratory if a biohazard is present. Use paper bags, envelopes, boxes, and similar materials for all biological evidence. Avoid plastic packaging as an inner or outer package. Which we see something bloody. It looks like someone's t-shirt, maybe something bloody in a plastic Ziploc bag. Did you see in the earlier picture? Avoid the use of pill tins due to possible rust. Ensure that all swabs and evidence are dry. Package each item separately. Avoid commingling items to prevent cross-contamination. Swabs collected from a single item excuse me, good grief, may be packaged in the same container. Mark each package with a detailed description that includes the item, location where it was collected, name of the person who collected it, and the date of collection. Seal each package with tape. Staples are not considered a proper seal. All seals must be marked to identify the person making the seal. Mark through the seal with the name or initials and date. The integrity of the item is often maintained through the package's documentation. That documentation includes all markings, seals, tags, labels used by all of the involved agencies. Therefore, it is critical to preserve or document all packaging and labels received or returned to your agency. Document evidence. During the collection process, it is essential to record the location of evidence collected at a crime scene. These are effective methods to do this. Use photographs and placards to document the location of each item. Develop detailed documentation that describes the item, location, where it was collected, name of the person who collected it, and date of collection. Make a sketch of the scene that includes distances and a legend. Contamination prevention. To limit the potential for outside contamination of evidence prior to and during the collection process, secure and limit the scene to essential personnel. Change disposable gloves if there is contact with biological material. Avoid glove-to-skin contact that can occur by rubbing eyes or nose or wiping perspiration. Avoid talking, coughing, sneezing, perspiring on or over evidence. Sorry, that... Avoid walking on or over evidence. Avoid hair loss at scene from head, arms, or face. Leave the scene if you become injured. Do not return until any blood loss has been stopped and clothing is clean. Do not eat, drink, chew gum, or use tobacco at a scene. Consider the use of disposable personal protective equipment, PPE, such as gloves, masks, shoe covers, coveralls, and hair covers when appropriate. Avoid skin and oral contact with investigatory tools such as measuring tapes or pens that may have contaminated surfaces. Do not discard any trash in or near the crime scene, such as cigarette butts, used disposable gloves, cups, or bottles. Take care when using cell phones, radios, or other personal items. Make sure not to use them when you have gloves on to avoid contamination. And there's a link. All right. We'll probably do at least one more. Maybe two. Darlie's blood loss. Below is trial testimony regarding Darlie's neck wound and the resulting blood loss. Dr. Patrick Dillawn, senior resident doctor at Baylor University Medical Center in the ER when Darlie arrived around 3:30 a.m. on 6/6/96. Direct examination. And when I came to the resuscitation process was ongoing. When I came in, the resuscitation process was ongoing. In my initial examination, Darlie was covered with blood. She appeared to have stab wound on her neck, which was either she or one of the techs was holding pressure on it with a gauze bandage. All right, now someone with a neck injury like she had in that area of the neck, what is that called? What area of the neck do y'all refer to that as? We divide the neck into 3 zones, and that is how we manage them, and that is what we call a zone 2 injury. Okay, and how do you manage a zone 2 injury? It's just these kinds of injuries are divided up either for penetrating injuries, either by a stab wound or a gunshot wound. And you can either manage them selectively or go to the operating room. You can do studies or go to the operating room. It's sort of a clinical judgment of what we do, and we base criterion if they've penetrated a muscle called the platysma, which is below the skin. And in her case, the wound was clearly through the platysma or on superficial examination, and that's as far as you want to go. Okay, why is that? Because you might disrupt a blood clot that's tamponing a vessel, which means it's keeping it from bleeding, and you could make a patient worse in an uncontrolled situation outside the operating room. So the best way to control that is to take her into the operating room and do some exploratory surgery. Yes, take her to the operating room and see if she has anything significant injured. So what we did is we undermined the skin a little bit to expose it and retracted the skin back and just looked and litigated the vessels that were bleeding and looked for, what does that mean? That means tying them off to stop them from bleeding with a suture. Okay, and then what? What's the next thing you saw? Well, when we looked at her, we saw several small veins bleeding, which we tied off. Well, when we looked at her, we saw several, okay, there said it again. And these veins on the neck are close to the internal jugular vein, which is a large vein, so they were bleeding. And once we stopped those, the wound was what we call hemostatic. The bleeding had stopped. And then we just irrigated it and looked around for anything that looks suspicious. For a major vessel injury, injury to the windpipe, injury to the esophagus, and we didn't see anything. Cross-examination. All right, did you review your discharge summary that you dictated and that Dr. Santos approved? Yes, I did. And did you characterize the wound to Miss Routier's neck as a large slash wound? Is that right? Yes. And if it was previously testified that this slash wound penetrated the platysma muscle and was previously testified by a medical expert that it reached to 2 millimeters of the carotid artery, you wouldn't disagree with that expert, would you? What I saw in the operation was I saw a very small portion of the carotid sheath. That was nicked? No. But you saw the sheath? I saw the sheath. The carotid sheath? Yes. And let me ask you this, and if in layman's terms, as just us laymen would say, it's not normal to have an hour and 15-minute under general anesthetic for a wound, that's considered surgery, right? That's surgery, yes. She had a diagnosis from Dr. Santos of post-trauma anemia, and that's from a severe loss of blood, right? I would say a mild loss of blood, moderate. Dr. Alejandro Santos, trauma surgeon at Baylor, operated on Darlie, direct examination. There was a lot of people in the room, so there was a lot of commotion going on, but I got a chance to see her. She had a laceration to the neck with a lot of blood on her chest and her body. And I agreed with the surgery resident that in view of those injuries, we needed to take her to the operating room to explore the wounds. When I walked into the room, she had a slash wound, or a laceration to the neck, kind of tangentially going from the right side to the left, or left side to the right, across here, across this area, across her neck. And as I said, she had a lot of blood on her. Because the residents had already examined her, and based on my quick evaluation at the time, I felt it would be best managed up in the operating room. Okay, tell the jurors why it's best to go immediately to the operating room with that type of wound. You don't want to take any chances with any type of neck wounds. There are a lot of vital structures in the neck, the vessels that feed blood to your brain and vessels that bring blood back to your heart, as well as your trachea, the voice box. All those kinds of injuries can be very devastating if they're not taken care of right away. So it's usually better to go examine those in the operating room and get better control in case you get into trouble. We washed the wounds, cleaned this all out, and we were able to look at it. Once we had her up in the operating room, under the anesthetic, with everything cleaned and prepped, there was very little bleeding at this time. So we explored the wound and found that most of the bleeding had come from the veins that are located underneath the skin and kind of in what's called subcu, or the fat tissue that's under your skin, underneath your skin. There's a bunch of veins here in the neck area. Some of those were injured. We repaired those either by using electrocautery, which is an electric type of current that coagulates the vessels, or we put some stitches in the small vessels. We washed out the rest of the wound. We noted that the wound went down what is called the platysma, which is the muscle that kind of covers your neck here. When you do that, you can see it flexing. Her wound went down to the platysma, had a little nick in it, but did not go beyond it. So we have found that the extent of the injury, we washed that out and closed the neck wound. So what did you do to repair the wound? As I said, we washed it out and we made sure that the bleeding was controlled and then put some sutures in there to close the wound completely and put a dressing on that. Okay, so you made sure the bleeding was controlled from these veins that were cut? Witness nodding head. And then just sew, did you sew Miss Routier up? Yes, we put what is called a something stitch underneath the skin, but we closed the wound up completely. Cross-examination. Correct. This is a discharge summary dictated by Dr. Dillawn, which I signed. Yes, it says she has a large slash wound. All right. Well, you signed it. You approved it. Is that right? Yes. And you described Dr. Dillawn and you approved his description that she was actively bleeding from a large slash wound? Correct. Now, that was the first scene that any doctor saw, an actively bleeding woman who had obviously lost a large amount of blood on the front of her shirt. Is that right? Correct. Now, you also gave her either on discharge or upon when you admitted her, I don't know exactly where it is, but you gave her a diagnosis of post-trauma anemia. Is that right? Yes. Now, post-trauma anemia would be from a severe loss of blood. Is that correct? Correct. Any loss of blood that will make your numbers go down. Medically, that's defined by certain parameters. And if your blood count, your hematocrit specifically is below normal, then you're by definition anemic. All right, but in any event, what you describe it was, and I can't say the word, it's post-hemorrhage. Well, it's post-hemorrhagic. Right. Yes. Okay. Close. Yes. So I try to say it post-trauma. Right. Same thing. Well, post-hemorrhagic just means she bled. That's why her blood count is low. Post-trauma doesn't necessarily mean she bled. You can bleed internally, etc., but post-hemorrhagically, anemia specifically means you're anemic from blood loss, from loss of blood. Larry Wayne Byford, paramedic who assisted Darlie with her wounds on 6/6/96 at the house, Direct examination. The right arm here, and then she had a rag. Either she was holding a rag or he was holding it, like it looked like a cup towel comes to mind. And I opened up some sterile 4x4s and I got those ready to put them in place. And then we taped them. Taped the 4x4s in place. Okay, so you actually then took a 4x4-inch sterile gauze pad, is that right? That's correct. Put it over the wound on the neck? Yes. That was to stop the bleeding? Yes. Jody Fitts, RN in the ER when Darlie arrived at Baylor, direct examination. She arrived to me completely nude, covered head to toe in dried blood. She had a dressing around her neck and around this right arm. Her neck was bleeding, is that right? Her neck initially was not bleeding. We pulled the dressing off. It was initially not bleeding, but the surgeon there had to explore the wound just a little bit to look at it. And after he had touched it just slightly, a bit of blood squirted out of the wound, which would to us indicate an arterial bleeding, and that we don't want to mess with in that emergency room. So we immediately covered that back up. Dr. Vincent DiMaio, doctor called by the defense to testify about the severity and nature of Darlie's wounds. Hearing, she has shown significant blood loss and that her hemoglobin dropped 2 grams. Direct examination. Dr. DiMaio, in reviewing defendant's exhibit number 93, that is the operative report, did you determine from that report that Darlie Routier had experienced considerable blood loss? Yes, sir. When you look at the rest of the medical records, they indicate that when she came into the hospital, she had a blood hemoglobin that is the kind of measurement, the amount of hemoglobin that you have in your blood. A blood hemoglobin level of about 11.6, and this is about 3:30 in the morning. Then by the next day, it had dropped 2 points from 11.6 down to 9.6. And what happened was she had lost a significant amount of blood from this injury. But it's not initially reflected. That is, what happens is that when you lose blood, your body compensates for it by mobilizing fluid from outside the bloodstream and pours it in. In addition, when you go to the hospital, they run those IVs, they are putting in fluids. So what happens is that her hemoglobin appeared relatively normal when she came in because the blood had not been diluted by the fluids. The fluids came in, it dropped. And what it means was that she had lost a significant amount of blood from these wounds. And in fact, one of the diagnoses was acute post-hemolytic anemia, which meant that she lost a lot of blood. So these wounds were not, and the other wound on the arm caused a drop of 2 points in her hemoglobin, which is a significant drop. Please note the discrepancy between Dr. Santos' testimony and Dr. Dillawn's. Dr. Santos said that a severe loss of blood caused Darlie's post-trauma anemia. Dr. Dillawn lessened the severity of the blood loss to mild or moderate. Dr. DiMaio also referred to the anemia, stating that Darlie had lost a lot of blood. After reading the above testimony, it is clear that Darlie lost a very substantial amount of blood. And here is a pool of blood left by Darlie while being treated by the paramedics on the front porch. And links to the testimony. All right, we'll do one more. Okay, this is about Xanax, and I'm not exactly sure why this is here, but here it is. So we'll just give it to you. I'm not exactly sure what this is for. I believe Darlie might have been put on Xanax sometime at the hospital or after the hospital to help control her nerves, I guess. And there's probably going to be a lot of big words that I can't say. So here we go. Some pharmacology on Xanax. Xanax, or alprazolam, belongs to a group of drugs called benzodiazepines. Benzodiazepines act on the CNS, central nervous system, by slowing down neurotransmitters, GABA in particular, much like barbiturates, but they are shorter acting and with fewer side effects. Because of this, they are used to treat anxiety disorders, panic attacks, and anxiety caused by depression. However, they are not used to treat depression. The benzo drugs are intended for short-term duration, 1 to 2 weeks, because major side effects are rebound anxiety and addiction. Some are used to treat seizure disorders too. Many are given pre-operation to calm the patient and make them forget what's happening. There's some dosage information. Xanax may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Xanax is a mood-altering drug, so important decisions should not be made while taking it. Some side effects worth noting: unusual risk-taking behavior, decreased inhibitions, no fear of danger, transient amnesia or memory impairment, confusion, hyperactivity, agitation, memory problems, trouble concentrating, dry mouth. Derealization is never a standalone anxiety symptom. It is almost always comes to at the peak of stress. Derealization is incredibly complex. It's so complex that it's not entirely clear what occurs in the brain to allow people to trance out from reality. It's believed to be one of the body's natural coping mechanisms. During intense periods of anxiety, as occurs with panic disorder and other severe stress disorders, the mind essentially decides it's going to tune the world out in order to cope. And depersonalization is a dreamlike feeling of being disengaged from your surroundings, where things seem less real than they should. It may be thought of as disturbing sense of being separated from oneself, observing oneself as if from outside, feeling like a robot or automation. Feelings of depersonalization are usually triggered by life-threatening or traumatic events, such as extreme violence and war. Who is at risk of depersonalization? People who have been exposed to a very traumatic experience. This sounds like Darlie, for sure. Some common side effects, how Xanax works on your CNS, mechanics, information about the receptors, lots of warnings for a reason. And this also came from the nurse. Okay. So, like I said, I would imagine that Darlie was probably put on Xanax to help her calm down, because she was very, very clearly upset and probably going through a whole range of intense emotions and needed some help coping. So I think that that's why this is brought into here. Sorry, like I said, I have not gotten that deep into it, so I don't know that for sure what's going on, but here it is. That would be my best guess. And again, I want to thank Why Darlie Routier's Innocent Myth versus Fact for allowing me to share these myths versus facts, and there are lots more, so we'll do some more on the next video. And I just want to thank you for watching, and please hit subscribe and leave some comments down below if you'd like to chat about this. Thank you.